Tanzania, countless women live with a pain that has no visible wound, a condition that whispers through communities, often unheard and misunderstood. Endometriosis is more than a menstrual discomfort. It is a chronic illness that delays dreams, dims future, and disrupts everyday life. Globally, endometriosis affects an estimated 5% to 15% of women of reproductive age, and among African women, studies suggest a prevalence ranging from 2% to 10%, though the true numbers may be higher due to underdiagnosis and limited awareness. With stigma, limited resource, and silence standing in the way, women fight to be seen not just as parents, but as voices for change. Now, let's hear from one of the medical students from University of Dar es Salaam talking about this condition referred to endometriosis.
Hello there, my name is Vijiji Tanzania. I am a medical student at the University of Dar es Salaam, Mbeya College of Health and Allied Sciences. Endometriosis is a gynecological condition whereby a tissue similar to the lining of the uterus called the endometrium, it grows outside the uterus. It can be in the ovaries or in the fallopian tubes. So although it's outside the uterus, it still behaves as it will in the uterus. So it can thicken, it can rupture during the menstrual period, and it can bleed. But the normal menstrual period, it has nowhere to go, so it leads to inflammation, leads to pain and scarring. A person with endometriosis will have symptoms like we refer it as the 3Ds. The first D is dysmenorrhea. The second one is dyschezia, and the third is dyspareunia. When we talk about dysmenorrhea, we talk about painful during menstruation. When I talk about dyschezia, I talk about painful during bowel movements like defecation or urination. When I'm talking about dyspareunia, I'm talking about pain during sex or after sex. So a person will experience these symptoms, but also will have fatigue, will have nausea and other symptoms. But still, a person may still see it as just bad ones, which is not that. And when we talk about the diagnosis of this condition, we can use imaging tests like MRIs and ultrasound. But the golden test, the golden standard test, is we use paroscopy. So in paroscopy, we insert a camera into the abdomen to see the biopsy of the lesion. The first one, which is the common one, is infertility. Around 30 to 50% of the women with endometriosis have shown to be infertile, like problems with conceiving. Also, a person will have abrasions and organ damage. The tissues, the scarring may cause tissue to adhere to each other and resulting into organ damage. But one of the most common things is the chronic pain. A person with endometriosis will have this pain, which will lead to that person having depression and anxiety, which may limit the lifetime of the individual. Also, a person with this will have ovarian cysts, which we call the endometriomas. But when we see in our African context, we still pose a challenge in diagnosing this disease because of limited gynecological specialists and the cultural taboos. Thank you.